No review of migraine would be complete without the discussion of cluster headaches. Cluster headaches are a distinct, although rare, clinical entity that occurs in 0.4% of the population. Attacks of headache occur several times a day in clusters for several days or weeks at a time. The headaches are shorter than migraine, last from 15 to 30 minutes and up to 2 to 3 hours. The pain is usually severe, knife-like, unilateral, and usually centered around the orbits or supraorbital area. Autonomic features such as conjunctival injection, lacrimation, nasal congestion, rhinorrhea, meiosis, ptosis, and eyelid edema are all part of the syndrome. Patients are then headache-free between clusters. Unlike migraine, cluster headache is predominantly a male disorder beginning between the ages of 20 and 50, with a male to female ratio of 4 to 1. Joe has cluster headaches, which occur every 4 months or so, and usually the headaches last anywhere from 2 to 4 weeks. A headache can last anywhere from minutes to hours. How long have you been having headaches?
I've had cluster headaches diagnosed now for the last 3 years.
How often do you get headaches?
Cycles about every 4 months, and the cluster can last as long as 2 to 4 weeks.
What age were you when the headaches first began?
It started around about 44. I'm 47 now.
Do you know when a headache is coming on? Do you have an aura?
No precursors that would indicate I'm going to get a cluster headache. When the pain starts, that's the start of the cluster headache.
When you get a headache and you're in a cluster, do you have many headaches during the day?
1 or 2 clusters in a 24-hour period, but they can come one after the other, over a period of 2 weeks.
Are there any aggravating or precipitating factors that you can see?
None that I can put my finger on right now as to what will precipitate a cluster headache.
When you get a headache, where's the pain located?
It's a very sharp stabbing pain in my eyeball, and then the burning sensation around the orbit of the eye. It'll go back through the temple into the back of my head and then down my neck.
What's the longest that the pain has lasted?
For one cluster headache, I've before medication had one that lasted about 8 hours long.
On a scale of 1 to 5, with 5 being the worst possible pain, how would you describe your pain?
About a 4. I would say a compound fracture would be a 5.
And do you have associated symptoms with these headaches?
Yes, the side that the cluster headache is on, that sinus will have a very sharp burning sensation. That sinus will run. The eye on that side will tear, and sometimes I'll have that burning sensation go up into my scalp also.
Do you have any members of the family with migraine headaches or cluster headaches?
Yes, a brother, a sister, and my mother suffer from migraines, or have suffered from migraines in the past.
Do any of them have cluster headaches?
None have been diagnosed with cluster headaches so far.
Now, have you ever had any diagnostic studies done?
Had an MRI for my neck and my head.
And are they normal?
They were read as normal, yes.
Okay. What medications have you tried in the past?
In the past, there have been a number of medications that I've tried. Prophylactic naproxen and metoprolol and amitriptyline, and then to treat the pain, there was Cafragot, Migranol, Stadol nasal spray, Fioricet, Furanol, a number of painkillers, Tylenol with codeine.
What medication are you taking now?
Sumatriptan injectable, and then the Emerge tablet.
And do these medications totally relieve your headache?
They've been phenomenal is the word I would use. It has taken the cluster headache and knocked it down to where there's no pain.
Now, these headaches, are they disabling?
Yes. I found that that stabbing pain in my eye so intense that I couldn't work. I would have to leave my desk, walk away from the computer, and try to find some quiet place, or go home, leave for the rest of the day.
And now?
Now I can take a sumatriptan injectable, an hour later take the Emerge, and by that time the cluster headache is done. It's finished.
Joe represents a typical case of cluster headaches. He has tried multiple medications in the past. he now has 100% relief from sumatriptan injections. Because cluster headaches are so brief, injectable sumatriptan or nasal sumatriptan are the only triptans which work fast enough to give the patient relief of his headaches. How do you treat cluster headaches? 1. Oxygen is the standard recommended treatment, with 100% oxygen administered at 7 to 10 liters per minute for approximately 15 minutes. Approximately 70% of patients will get some relief from their pain. 2. Subcutaneous sumatriptan is an effective medication for acute symptoms. The medication may have to be repeated with a second dose. And finally, 3. Prednisone given in large doses during an attack will help suppress headaches.